Hello. I must thank for the opportunity to introduce our small association in the Czech Republic. First, some information about the number of Prader-Willi person and about association. It brings together patients with Prader-Willi, their parents and sympathizers. At the current time, it has around 40 to 50 registered numbers, but the number changes each year. It's not the final number of families. I personally know about maybe 50 more, but they are not our members. The precise number of persons with Prader-Willi in our republic is not known. There is only a number from national database of patients which were treated or are treated with growth hormone. It's about 120 persons or children, but there are not patients which are older and they weren't treated, or they were treated before the database was set up. So the estimated number of patients is therefore around 200, 250, but we don't know where they are. Some information about associations' aims. They have been defined over the years, not in the very beginning of our association. They are to increase knowledge of Prader-Willi syndrome among the expert and lay public. I think it's very important because even now families have to explain what Prader-Willi is, even to doctors. Then to provide the latest information about treatment to families. We try to do it. Regular meetings of families and passing on of personal experience. Advice on social support, social services, integration and assistance. Creation of housing for the group of adults with Prader-Willi syndrome, and support for the establishment of a specialized workplace for pediatric and adult patients with Prader-Willi syndrome. In most of them, we are at least partly successful, not in the last one, because it's problem of rare diseases in our country. In global, I think that it is a very long-term aim. So we have to work on it. There is no multidisciplinary care for most of rare diseases in our country. How we started. Our association was established in 2003 at a time when some of the symptoms of the syndrome could be treated with growth hormone. Until then, there was no treatment for patients with Prader-Willi, and they were not registered anywhere, and the families didn't know each other. At the beginning, we were about 12 families. So it was established by parents, and also the parents work for the association in their free time. We have a working group, and this group of parents participates in all organization of activities. In the beginning, there was no experience how the association should function, and we organized only one day and later weekend family reunions. Very important for us was the when we could attend a conference in Cluj-Napoca in Romania in 2007. We got there a lot of information, not only about syndrome, but also about associations in other countries and a lot of contacts. And the second milestone, I think, was in 2008 when we were invited by a German organization, EJF Lazarus, to Silberbach, it's in German, to a German-Czech workshop with the topic aggressivity in Prader-Willi. And there were caregivers from various homes for adults with Prader-Willi from Germany, and from our republic, we parents. It was the first time we met somebody who had some experience with home for adults. And later that year, we were invited to Berlin to home for adults, which was by EJF Lazarus, and we liked it very much. The model was a big flat. We met the people there, we spoke to them, and they seemed to be very happy. And we liked it and wanted to create something similar in our republic. The next conference in 2013 took more information and more experience. So now I would like to return to the housing because I wanted to end with it. The housing for adults has started in January 2021. It is the first in the Czech Republic, and it is for 5 adults, 3 women and 2 men, and respects the specifics of Prader-Willi. The housing was created as a separate household within the existing social facility Domov Maxov, is Home Maxov. It is a similar model as in Berlin, as we wanted, a large apartment. Each user has his own room with bathroom, shared space with kitchen, without free access to food, 24-hour supervision, and trained staff. Clearly structured day, various therapeutic workshops, plenty of exercise, especially walking outdoors because there is a very nice countryside, and weight control every day. What I want to say, what preceded it, 18 years of convincing authorities and providers. It started in 2008. I don't know if in another countries are the same problems, but our authorities didn't want this type of social service because maybe it is more expensive. There were very few adult persons with Prader-Willi, and it is a special service different. So we had to convince them so long. And the last 2 years, we cooperate with the management of Domov Maxov, which was very helpful. And I must thank to the director because his huge effort take us to the end of our trying. We helped with mediation of information about Prader-Willi and specific experiences with housing in neighboring countries. We organized visits in several facilities in Germany. 2 years ago, we visited about 5 or 6 and cooperated with the management, informing families, survey of interest, and so on. And in the end, we did it. So we are very happy. From other activities, as I mentioned before, regular family gatherings. We make 2 in a year. and the one with a professional program. There are 2 or 3 professional lectures occurred by volunteer assistants. And the second one is more focused on walks and trips. And always there is a program for children and for their siblings, competitions, disco, and so on. Then information materials. We had translated medical alerts. It's translation of the original International Prader-Willi Syndrome Organization leaflet. Then we created some information leaflets and, for instance, a chapter on PWS in methodology for teachers and some translations of articles. Then media, there were some articles about PWS in newspapers, magazines, a couple of documentary films. And in some cases, this all have helped to diagnose older children. Then we take part in some seminars on PWS. We try to cooperate with other organizations, rare diseases organizations, and we also provide materials and mediates contact between families and students of medical and social schools if we are asked, and also cooperate with doctors, other experts, participate in studies, surveys, and so on. We have our website, Facebook, and we also participate in organizing concerts in support of the association, because it helps also to increase awareness of our syndrome. We are also member in other associations in rare diseases, Alliance for Individualized Support, and international organization. So it's all. Thank you for attention.